Congenital anomalies of the lens. Lenticonus. This is a capsular thinning or defects allowing cortex to bulge in a conical way. Types of lenticonus: anterior lenticonus and posterior lenticonus. Anterior lenticonus. This is a bilateral condition affecting males. It is associated with Alport syndrome, composed of hereditary hemorrhagic nephritis, deafness, abnormal type 4 collagen. There is oil globule reflex seen in pupillary area. Posterior lenticonus. This is a unilateral sporadic condition, more common in girls. Lens coloboma. Lens coloboma is absence of lens zonules. It is commonly associated with ciliary body coloboma, and rarely due to ciliary body tumors as in medalloepithelioma. Congenital cataract. Lens opacities present at birth or developing during the first year of life. It is an autosomal dominant condition in 34% of cases or may be idiopathic in 33%. Congenital cataract may be associated with systemic diseases in 33% of cases. Zonular or lamellar cataract, where there is a zone of opacified fibers as in neonatal tetany. Anterior polar cataract. Congenital anterior subcapsular cataract. Posterior polar cataract results from abnormal hyaloid resorption. Rubella cataract. Dense nuclear cataract with retained nuclei in embryonic nucleus. Lowe syndrome composed of discoid lens and capsular increscences. And Down syndrome. Zonular or lamellar cataract. This is cataract affecting one or more lamellae outside the fetal nucleus. It could be hereditary, caused by malnutrition as in hypovitaminosis D and hypocalcemia, or there may be an endocrinal anomaly as in hypoparathyroidism, tetany. There is a central opaque disc. Peripheral projection, which are riders with anterior and posterior limbs overriding both lens surfaces, the so-called cartwheel shape. Clear fibers separate the riders from the main opacity. Anterior polar cataract. Cataract affecting anterior pole of the lens. It constitutes 3% of congenital cataract. Delayed formation of the anterior chamber results in persistent contact between the corneal endothelium and the lens. This results in subcapsular epithelial proliferation with calcium deposition leading to pyramidal opacity with corneal endothelium covering the anterior capsule by a hyaline membrane. Anterior polar cataract may be a disc-shaped opacity at anterior pole, a pyramidal opacity, hourglass opacity, or duplicated cataract. Posterior polar cataract. Cataract affecting posterior pole of the lens. It is due to persistent remnants of hyaloid system. Disc-shaped opacity at the posterior pole is present in persistent hyperplastic primary vitreous. Fibrovascular tissue invades the posterior lens substance through adhesions in posterior lens capsule. Total cataract. Cataract affecting all lens layers. It is caused by rubella infection in first trimester in 50% of cases. The virus particles are present in the lens substance. There is total cataract, microphthalmos, retinopathy, and glaucoma. Also, there are associated cardiac anomalies. Other types of congenital cataract include blue dot cataract, where there are small dots scattered in the lens. Coronary cataract, club-shaped opacities at the lens equator.